So get up, get dressed, get moving. So changing the culture of acute care from gowns and rest to clothing and mobility. My name is Curtis Newton. I'm a physiotherapist. So my inspiration for this project was a few studies initially. What happened to my legs when I broke my arm was a study that basically said even if you're not sick and your legs were perfectly fine, you spend 98% of the time in bed when you're in the hospital. And so that's a problem. The Move Ontario, so the Mobilization of Vulnerable Elders study, had 12,000 participants, and they found if they increased mobility by 10% in the hospital, they reduced their length of stay by 6 days. So that's the basis of this project. My inspiration for ending PJ paralysis was Dr. Jenny Bazarin and her Twitter. She was tweeting about ending PJ paralysis and that project that was initiated in the UK last year. So this is my driver diagram. I find this very useful as in terms of sort of guiding my thoughts as well as next steps. So my aim was to increase observed independent mobility in units 1 and 2 at Cypress Regional Hospital from 66% and 56% by 10%, and that's guided by the Move Ontario study. So I found I had a tri-storming session. I found this useful in terms of I had to gauge. I was engaged in this project. I had to engage 2 other units of people to kind of participate in it. So I had a large group of about 20 people made up of patient and family advisors, leaders, and frontline staff. And we got together and kind of did the force field analysis and discussed. We had content experts discuss the project as well and get people engaged and start talking about mobility. So this was a very useful step in the success of the project. Communication was a big thing for me. I wanted to brand the project, have it out there so that everybody knew about it. This took a lot of time. I wasn't initially planning as part of QI to be making posters, but I had to do that. And so my results. So what we did is the increase in patient clothing on units 1 was about 25%, increase from 3% to 25%, and unit 2 was 5% and went up to 27%. Mobility was 70% as baseline data, went up to 85% on units 1, and 65% in unit 2 went up to 67%. But when I did actually a correlation analysis of the data, it's very interesting. The wearing clothing and mobility actually correlated poorly. So the fact that the mobility went up was more to do with the project and the changing the culture, and not necessarily the clothing themselves. So that was actually kind of an interesting thing that I can discuss with you later. So my learning, I learned the value of social media, and I think the main thing for me, my aha, was the value of patient and family advisors. I think talking to, especially my patient and family advisor, Jean, and her mother, she's 101, about our elderly when they're in the hospital. I think that's been very useful for me, and I plan to use that in the future. Challenges are time and staffing. I think we're short staffed in Swift Current. It was hard to put a lot of time into the project that I wanted to. And my next steps, I want to do a walking track. There's the Johns Hopkins Everybody Moves campaign this summer, as well as the Ending PJ Paralysis World Summit. I'm going to expand to other acute care units and develop a work standard for mobility intervention in Swift Current.